I'm Dr. Karen, and you're watching Dr. Karen Health TV. I'm a licensed psychologist in Fort Lauderdale, Florida, and a board-certified sex therapist. I am here with Dr. Robert James Fink of Gold Coast Orthopedic Spine and Hand Surgery from Chicago, Illinois. Dr. Fink, thank you for joining us today. Our mission is to bring to our audience lots of different questions that people have about surgery, about healthcare, and we've invited you here, and thank you, by the way, for coming all the way from Chicago to South Florida to visit with us. And I would like for you just to tell us a little bit about how you decided to go into orthopedic medicine.
Going into orthopedics was a natural for me. I do a lot of sports myself. I see a lot of sports injuries, and I am good with people with sports, so that was a natural for me to go into orthopedic surgery.
So, obviously, when you went through your training, you went through all the traditional surgeries. What made you decide to start to veer from doing traditional surgeries to the alternative procedures that you're using today?
50% of my practice is minimally invasive spine surgery, and where I am able to do taking out discs through a small incision with a telescope in the spine. And that allows people to rehabilitate quickly. They can get right out off of the recovery room bed and walk home. And this is a great contrast to the traditional opening the back with an incision. When you open the back with an incision, you may always get an infection. It's a larger incision. It's more rehabilitation time because of this pain that you have to remove bone and remove muscles. The major muscle in the back for stability is called the multifidus muscle right in the center, and if you have to cut open that and remove part of that, you lose a lot of stability in the back. So I've gone on to do minimally invasive back surgery to get people better quicker, faster, and give them their life back, and less complications by not messing up that multifidus muscle or removing a lot of bone to get to the discs.
And I also noticed from your website that gives a lot of great information that you also do minimally invasive procedures on other parts of the body.
Yes, most of my surgery is minimally invasive, very small incisions, outpatient procedures. All of it sometimes is done in the knee with a telescope, which we call an arthroscope. Sometimes for an anterior cruciate ligament reconstruction, we use cadaver allograft, which is a cadaver patella tendon with 2 pieces of bone. There we do make little incisions, but the majority of all the surgery is done with a very small incision, and is done as an outpatient procedure. Some of the bigger procedures, like a total knee replacement, I do in the hospital, and I make the incision based on how large the person is. If somebody is a 2X, they're going to get a larger incision. If they're a size 4, they're going to get a very small incision.
So let's just say somebody is in pain and they're trying to make a decision about what to do. What would you suggest is the first step?
First step is to see a competent orthopedic surgeon come to Chicago.
So talk about that. You offer a very unique opportunity that most physicians don't do, and that is flying a patient in if they want to come and see you.
Well, we do different types of insurances. One is that I'm willing to do the car accident patient that is actively in a lawsuit. And those type of patients, I have facilities that will do everything on a lien. That we will lien the attorney and the case, the doctor's fee, myself, my surgical assistant's fee, my partner, the anesthesiologist, and the surgical center. We will all put in liens and wait it, even if it takes 7 years to settle the case, and then depending on what the case settles for, we get a percentage of that. We're willing to do that, and for people to come to Chicago, we have a discounted hotel that people can stay in. It's usually, like I say, outpatient surgery, so you can fly in one day, have the surgery, and go home the next day. We also have facilities, if you're dancing, to go to our nightclub where we have good arrangements. What's the next question?
So, it sounds like you're pretty generous. What made you decide to work with attorneys and right off the bat, as opposed to letting a patient wait for a very long period of time until they're eligible for surgery?
At one point in time, I dealt with a lot of HMOs that I saw I wanted to do the surgery, and then the primary care doctor in the HMO would not allow me to. So the HMO was delayed too much. So I looked at other avenues of gaining patients. I dropped all the HMOs, and one of the avenues of gaining patients was from attorneys.
If a patient was looking for a competent orthopedic surgeon, what kind of questions would they want to know?
They want to know how often the procedure is done by the doctor. They would want to know his success rate. And I guess they would want to meet the doctor and feel that they have confidence in the doctor operating.
Well, we talked about this off so I'm not going to ask you how long you've been in practice, but what I would like for you to say is just talk about your favorite kinds of surgeries and what it's like for you to do those particular procedures.
All the procedures are my favorite procedures, and I usually get good results, and what I like about it is that I get pretty much quick results. One of the reasons is because it's minimally invasive, very small incisions, less rehabilitation time. So I guess the thing that I enjoy the most is that often there's a dramatic improvement. If they're not 100% better, they're improved pretty quickly.
So is there anything else that you would like to convey to our audience today about what you do, what you have to offer, what's unique about you and your practice?
Well, our practice, as I already mentioned, is with the attorneys. We'll do it on a lien, but we will do workman's compensation cases. If it is a good case, often we will want to talk to the attorney and know that it's a good case. But in that case, again, we want people to come and fly into Chicago. We would wait on the settlement again on a workman's compensation case. If somebody does have a private insurance, they're always welcome to come also.
Our producer, Charles McClendon, showed me some of the videos that you have sent to him. I was not only impressed with your technique, but your bedside manner. It seems like you really enjoy what you do, but you also like to teach. And you were very patient with everyone that was, well, at least from the videos I saw, of everyone, and you really seem to look like you work as a team.
Well, that's a true statement. In our surgical centers, we have a team of doctors, nurses, technicians, anesthesiologists that we've been working together for a long time, and we are a team, and they can assist me in doing the operation effectively and quicker.
And so when patients come to see you and evaluate you, they feel the cohesiveness of your team.
They should feel the cohesiveness of our team, as well as the hospitality and friendliness of the nursing staff that will take care of them before the surgery and then after the surgery.
Well, it was very generous of you to make a decision to start filming these procedures and making them available for people who want to know what's going to happen to their bodies. So, Dr. Fink, I understand that you are the very best orthopedic surgeon in the Chicago area. That being said, what I'd like for you to do is talk about one of the reasons that you decided to start doing videos of particular procedures and what you hope to accomplish by doing that.
Well, I think I've covered a lot of topics with my little infomercials of the operations and talking about the operations, so people will have a bigger feel for what's going on, such as in my knee video, we show what torn cartilage looks like. We show part of the operation where we take this torn cartilage out, so people will have an understanding of what's going on in their knee. When we explain to them that they have torn cartilage in their knee, they'll have a much more understanding of what it is and what we're going to do for them and how we're going to get them improved. Other topics that I've covered is carpal tunnel syndrome, a very common topic that people get from repetitive use of the hands. Also can be in car accidents holding on the steering wheel when you get rear-ended. This is a problem to the patients that lose feeling in their fingers, have to wake up in the middle of the night shaking their hands and have pain in their wrists. And I show in my video how our minimally invasive procedure on the hand will get them back to using their hand and back to recovery quick.
So, what percentage of your patients really want to see some of the procedures actually done, as opposed to just telling them information, giving them verbal ideas about what they're going to experience, versus actually using these as a teaching tool?
So videos will be available soon of all different topics on my website.
And so they can just visit your website and type in a question and
No, they should visit the website, and then it's going to have categories. So if you have a problem with your shoulder, then you'll be able to click on the category of the shoulder. I'll explain some operations we do in the shoulder for the diagnoses, and then there'll probably be a shoulder operation that you can watch. If you want to focus in on something like the elbow, once again we'll have some data on the elbow as well as a video on the elbow. If you want to have something done to the foot, we'll have data on the foot with some operations on the foot. So you can select whichever part of the body is causing you pain and you're having a problem.
I would like to ask you a case study that you've done recently that was of particular interest to you.
The interesting case that I had, which is now, this is going to be more of a unique case. This is not a common problem. This is a patient that ruptured his patella tendon, that the kneecap attaches to the tibial tubercle by your patella tendon, and if you rupture this, you won't be able to fully straighten your knee. And this boy was in a car accident, and then there was time went by before he went to a doctor. This was more of an indigent boy, and because time elapsed before he came to me, he didn't go to a doctor right away. He went to a chiropractor. They did some therapy. They didn't realize he's not getting better, and months went by before he was finally referred to me. Because months went by, we could not just sew up the patella tendon. We had to reconstruct the patella tendon, where I had to get a part of a cadaver's kneecap, the patella tendon, and the tibial tubercle, and some of the quadriceps tendon, the entire extensor mechanism, and reconstruct his patella tendon. And that video we do have of that operation. So that was an intriguing operation, but that was a unique and more of a rare operation that I do.
That's one of the ones that I previewed before I got to meet you. It was fascinating and very extensive. Dr. Fink, I'm sure that in your line of work you deal with a lot of chiropractors. Maybe you can educate our audience about using chiropractic services and then what would happen about at what point they might want to consider more extensive medical care.
Chiropractors are good to go to for their backs. They will do manipulations to your back and passive modalities of therapy to your backs, hot packs, ultrasound, electrical muscle stimulation, and exercises. And often patients will go there and get entirely better. But if you reach a point that you've gone 3 or 4 months to the chiropractor, he's done all these treatments and modalities to you, and you're still not better, then you should be referred to an orthopedic surgeon like myself. Often you're going to need a surgical procedure. We start off slowly, sometimes just epidural injections, which is just a needle in the back and a Band-Aid afterwards. And we go progressively up to my minimally invasive techniques if you need it for herniated discs. Afterwards, I do send patients back to the chiropractor that they came from, and they will do the therapy, and I often will write a prescription of what therapy to do to them.
That's very informative. You're watching Dr. Karen at Dr. Karen Health TV. Dr. Fink, thank you very much for flying all the way in from Chicago to join us today.
My pleasure.
Thank you very much, and enjoy South Florida.
Thank you.
You're welcome.